Yeah, unconscious. I'm not worried. 911 call from hospital admin exposed. Nurse attacked. I'm not sure. She's probably going to die. This is this is making me mad. This video is brought to you with a heavy heart, and I'm going to talk about abuse within healthcare. So, abuse directed at healthcare workers is a growing concern that undermines their well being and the quality of care they can provide. Healthcare professionals, and this includes doctors, nurses, and even other support staff, often face physical, emotional, and verbal abuse from patients, their family members, or even their fellow colleagues. This mistreatment can manifest in aggressive behaviors, threats, harassments, and even physical violence, putting healthcare workers at a significant risk. The constant stress and trauma of working in such environment can lead to burnout, mental health issues, and even a decline in job satisfaction, ultimately affecting patient care. Addressing abuse in healthcare systems is crucial to ensure a safe, supportive work environment for those dedicated to caring for others. So let's talk about what happened in Palm Beach, Florida. So in Palm Beach, Florida, a nurse was tragically assaulted while working at a local healthcare facility, highlighting the growing issue of violence against healthcare workers. The nurse who was providing care to a patient was attacked by an individual who became physically aggressive, leading to injuries that required medical attention. This incident is a part of a disturbing trend where healthcare professionals, practically those who are in the front line, face increasing threats to their safety. Such assaults not only cause physical harm, but also can take a heavy emotional toll on healthcare workers who are often already dealing with high stress environments. So the assault in Palm Beach has sparked a widespread concern, underscoring the need for stronger protections, better training for dealing with violent situations, and more stronger legal consequences to ensure the safety of those who dedicate their lives to caring for others. A little back information. This patient was sent to this specific hospital under the Baker Act. Let us start by understanding what Baker Act is. A Baker Act patient is someone who has been involuntarily detained and examined at a mental health facility specific in Florida. The Baker Act is a law that requires people with mental health issues who are at a danger to themselves or others. What are the eligibilities? Eligibility for Baker Act. So the person has to have a mental health issue. The person has to be unable or unwilling to seek evaluation on their own. And the person is at a danger to themselves or others. Who can initiate such an act? So the law enforcement officers, a doctor, a mental health practitioner, or other professionals, or even the courts. What happens to a Baker Act patient? So the patient is taken to a mental health facility for evaluation and stabilization. Then the person can be held for up to 72 hours for adults or 12 hours for minors. The person is examined by a mental health professional within 24 hours of being admitted. Treatment is provided based on the evaluation. One thing we know is that, based on the news, this specific HCA hospital in Florida is not a Baker Act capable facility, meaning they're not well equipped to handle such patients. Such incidences place staff at risk and potential victims to assault. And that is what happened to this specific nurse. According to the news, the nurse had essentially every bone broken in face. And this is very tragic to this patient and to her family members. Now let's get to the scoop. Why your employer might not care about you. This health hospital administrator called 911. And this is after a patient or a family member also called the emergency team. And this for the information. Yeah, unconscious, not worried. 911 call from hospital admin exposed. Nurse was attacked. So the hospital administrator, we had a Baker Act beat a staff member unconscious, now running around the building. 911 dispatcher. You have the, sorry, 911 dispatcher. You said they assaulted the employee until they passed out. Hospital administrator. Yeah, unconscious. I'm not worried about that part. I need the Baker Act dealt with. And as the dispatcher sought more details, the administrator added a chilling remark. I'm not sure, she's probably going to die. Guys, this is inhuman. This is somebody who is working in your facility and you don't care. All you care about is the Baker Act patient taken out. This patient is going through a mental crisis. Yes, as a healthcare professional, I understand that. But don't you care about your nurse? And you say, I'm not sure, she's probably going to die. Who says that? Please, people, take good care of yourselves. Always remember, you are special as an individual. You are loved by your family. You are loved by your colleagues. And let me tell you one thing. Your job, you will be replaced as soon as they can. Oh. My heart goes out to this family. Always remember to take good care of yourself. Always prioritize your needs. Yes, it's good to prioritize your job and everything. But remember, is your employer going to stand with you in times like this? This was so obvious. These people don't care. This administrator here doesn't care. So, remember to take good care of yourself. And remember, you're loved, you're appreciated, and you're smart. So go out, make a difference, and take good care of yourself. Peace out.